Good afternoon, everyone. Hey, I wanted to take a minute and sort of drop something into your food for thought or just sort of things you're thinking about as you move forward in the course. During the course, we talk a lot about, issues with respect to healthcare, where PAs fit in, and really the cost of care. And what I've learned over the dozen or so times that I've taught this course is that there are many misunderstandings about really who the players are: good, bad, the evil, the white hats, the black hats, the good, the evil, whatever you may want to call it. And one of the things that keep coming up, and I took this little lecture I'm talking about now from a great talk by a guy named Michael Smerconish. He's pretty much an a-partisan commentator who talks about some things. And a while back, when he was looking at Medicare for all, or correction, the Obamacare, he actually used himself, sort of a Malcolm Gladwell approach, where he actually said, what would it cost for me under Obamacare? He's a radio commentator. What would it cost for me to insure my family under the exchange and under doing what I'm currently doing, paying for a plan myself? And so he really sort of sparked my idea on this. I did some research, but let's talk about a few things. So many of us think and hold the belief that insurance companies are bad because they're quote unquote for profit. But remember, being for profit or nonprofit is a legal status. We're going to learn a great deal about this with respect to other healthcare entities. But remember that being for profit does not necessarily mean that you are always going to be more expensive. You're going to be bad versus nonprofit is good. And there's a lot to learn about that. But let's take a typical family of four. And what is the cost of insuring a family of four? Well, you've learned from some of the things, old numbers, but from the T.R. Reid book, that the per capita cost per person per year is about $9,000. So roughly speaking, you're looking at about $36,000 for a family of four. That's annual per capita cost, obviously averaged. So assume your employer buys a policy for $12,000 a year, and the employee pays $12,000. So you got $1,000 a premium out of your paycheck. The employer's paying $1,000 a month. You're paying $1,000 a month for this $24,000 a year cash outlay policy. Now, all that being said, remember, I told you that the cost of care per capita is $36,000. Yet your insurance is only covering $24,000 of that. Okay? And again, what do you do with the remaining $12,000? So what do you have? Deductibles, co-pays, discounts on medications, deferred, delay. Where does it all go? So per capita, of course, means that 100% of the cost are allocated among those that are consuming it. So that doesn't mean that these costs magically get transferred to someone else. Okay? It means that they have to go somewhere. And that, in fact, is how they deal with things in insurance and why we see what we see. And this is whether you are for profit, nonprofit, self-mutual, a faith-based, like a MediShare plan. We are all suffering some of this, but really what happens and makes some of the plans work, in fact, is not the profit or necessarily the overhead of the insurance company, but in fact what we pay for the services. And this is the big paradigm, in that we don't have the consumer in healthcare or insurance making the decision like you would go out and buy a car or go to Costco to buy your groceries. You, in fact, have another party negotiating your price that you're going to pay or not pay, if you will, which is the goal of many people being covered by insurance. Because again, a big another debate is that is healthcare a right or a privilege? So per capita means that 100% of the costs are covered. So the scenario, again, that we're talking about, the family of four, does not even address the real cost of a family of six versus a family of two. So both the Democrats and the Republicans are really, in my humble opinion, stepping around the issue. And I look at it and say that we have a number of concepts that make healthcare and healthcare insurance in America uniquely American. And this is an issue that everyone steps away from. And these sort of ideas are cost versus price versus consumption versus flexibility and choice. So cost are actually, in pure economic terms, the resources required to provide a service. There's no profit, there's very little overhead unless it's direct overhead, but it's the bare bones amount of resources required to do something. Price, of course, as we know, is what you sell it for. You may sell it to the consumer direct, you may sell it to an employer, you may sell it to a purchasing group, but price is what you sell it for. Now, obviously, between cost and price, there is some profit to be made, maybe very minimal. A for-profit company would say the profit goes to, as some would say, their shareholders, and a nonprofit, it goes to reinvestment or retained earnings or a surplus if you're a nonprofit. Well, then you have consumption, which means in pure economic terms, at a certain price or cost, so much is consumed. However, healthcare does not typically behave in a pure economic manner, where consumption, because of the nature of what it is often not driven by price because the person consuming does not experience, in many cases, the true total cost. Example would be if a patient says, I want $1 million workup and my copay is $500. Do they really care about the $1 million workup if only $500 is paid by the person doing it for the $1 million workup? Of course they don't. So then you have cost, price, consumption, which is not especially influenced by our current American patient. You then have to have flexibility, which is sort of tied to choice. Flexibility is what you want, how you want it, sort of tied to choice, when you want it. I don't want it where I have to go at between 9 and 5. I want to go at 8 p.m. to an urgent care or to the ER. So again, there's a whole lot of things that are driving and making some things uniquely American. So when we talk about healthcare programs being proposed, Bismarck, Beveridge, National Health System, there are some characteristics that are uniquely American, which none of the TR Reid examples truly address completely and face these things head on. So the real issue is, can Americans face the truth, is what it comes down to. You know, when I think about healthcare, and you look about the trillions of dollars that we're spending on it, is that, you know, am I willing to decrease my income to pay 10, 20%, or 30% more in taxes to continue paying for healthcare at its current cost or price? And really, the cost of care is driven again by consumption, by flexibility, by choice. Will Americans be told no on the MRI, be told no on the total knee of a 90-year-old? Will we accept that? Because if we want to continue perpetuating quote unquote Medicare for all at the current cost of Medicare, as much as many think, the cost of care is not going to come down unless we're going to take the cost out of the system. That means PAs may go away. That means that MRI machines may go away, which will change choice and flexibility. So again, are we really willing to accept those things necessary as we consume more of something? In order to get the cost down, we have to take things away to make it so. Simply by volume does not make it more efficient. So can Americans face the truth? So what are really our options? In a recent Department of Health and Human Services study, they found that unsubsidized premiums on the exchange, for instance, were in 2017 were about $5,700, which means that insurance companies, profit or not, were only charging about less than $6,000 to cover someone for $9,000. So how do they get it? Delay, defer, deny, copay is how they actually. How do they get it as well? They negotiate discounts with services as far as providers in order to get the premium to pull out their profit. So, you know, in place of the American individual mandate, the American Health Care Act contains a provision known as continuous coverage. And this is something that really talks about the fact it was intended to make sure that no one is left with a gap of coverage where one plan cannot kick the can down the road, where a person gets coverage, then doesn't have it, gets really sick, and then gets back on coverage, and the new plan has to assume the cost of being off of care. So the whole point is having continuous coverage. But as you well know, the penalties were taken away. The penalties were never very stiff. As you recall from the Reid book, there are many countries, I'm thinking Japan, where they actually ensure that you have coverage all of the time. When you're in between employers, they have a fund that's accrued that will keep track of it, and you may have to pay the fund back with respect to that to cover both the principally catastrophic illnesses, which is really where all the money really goes. We talk about the Obamacare plans, and many complained that $5,700 a year plan often has a $5,000 a year deductible. So people would say, why do I even have insurance if I have a $5,000 deductible? Remember, cost of care is approaching $10,000 and I'm only paying $5,700 for it. How do you make up that difference? Deductible. So what's really amazing, we have in the United States, we have of 154 healthcare plans that have at least 100,000 enrollees, okay, 63% of them are non-profit. That's surprising. So with over 150 healthcare plans in the United States that have over 100,000 enrollees, more than half of them significantly are non-profit. Okay? Now, as for the profit plans, they're only 27%, and the remaining 16 or 10% of them are governmental plans. So again, of the 200 and some odd million enrollees in these 154 plans, 104 million, or a little less than half, are in nonprofit plans. Okay, so again, we keep making, in some cases, the bad guys out of these profit plans, but in fact, just about 50% of care comes from a nonprofit health plan. So, has being nonprofit solved the problem? The answer is, in my opinion, no. I would say to you that the biggest problem with our healthcare is the cost and price, consumption, and the requirements that Americans place on how we want our care. So let's kick it around. We'll develop this more as we move through the course, but wanted to drop this on you a little bit. Think about it, and we'll see where it takes us. So be safe, keep up the great work, and we'll talk to you soon.